Hello everyone. This section we will study the point about possible causes of cancers, part 3. Some substances cause cancer primarily through their physical rather than chemical effects. For example, the prolonged exposure to asbestos, the mineral fibers, are a major cause of mesothelioma. Other substances in this category, including both naturally occurring and synthetic asbestos-like fibers such as wollastonite, attapulgite, glasswool, and rockwool, are believed to have similar effects. Usually, physical carcinogens must get inside the body, such as through inhalation, and require years of exposure to produce cancer. Physical trauma resulting in cancer is relatively rare. Claims that breaking bones resulting in bone cancer, for example, have not been proved. Similarly, physical trauma is not accepted as a cause for cervical cancer, breast cancer, or brain cancer. One accepted source is frequent long-term application of hot objects to the body. It is possible that repeated burns on the same part of the body, such as charcoal hand warmers, may produce skin cancer, especially if carcinogenic chemicals are also present. Frequent consumption of scalding hot tea may produce esophageal cancer. Generally, it is believed that cancer arises or a pre-existing cancer is encouraged during the process of healing rather than directly by the trauma. However, repeated injuries to the same tissues might promote excessive cell proliferation, which could then increase the odds of a cancerous mutation. Up to 10% of invasive cancers are related to radiation exposure, including both ionizing radiation and non-ionizing ultraviolet radiation. Regardless of the time between inspections, radiation exposure is cumulative. Radiation can cause cancer in most parts of the body, in all animals, and at any age. Children and adolescents are twice as likely to develop radiation-induced leukemia as adults, and radiation exposure before birth has 10 times the effect. Sources of ionizing radiation include medical imaging and radon gas. Ionizing radiation is not a particularly strong mutagen. Medical use of ionizing radiation, whose main use include treatment, diagnosis, and sterilization, is a small but growing source of radiation-induced cancers. Ionizing radiation may be used to treat other cancers, but this may, in some cases, induce a second form of cancer. It is also used in some kinds of medical imaging, and the benefits of diagnostic tests often outweigh the potential risks. Modern technology and equipment also have significantly reduced the radiation dose in imaging examinations. To minimize the risk, some measures can be taken. If possible, choose an examination that does not require radiation, such as ultrasound or MRI. It is recommended to only use radiological diagnosis when necessary, especially high radiation doses such as CT and children. Try to limit radiation exposure during the examination, for example, shielding vulnerable parts of the body, such as the thyroid gland and abdomen of pregnant women. The symbol of radon is Rn, and the atomic number is 86. Radon gas molecules are monoatomic molecules of radon atoms. Radon gas is the heaviest of the gases, and it is also the only one composed entirely of radioactive isotopes under normal conditions. Radon gas in the atmosphere itself doesn't participate in chemical reactions, but the rays produced by its decay are harmful to human health. Residential exposure to radon gas has similar cancer risks as passive smoking. Radiation is a more potent source of cancer when combined with other cancer-causing agents such as radon plus tobacco smoke. When radon acts in combination with benzene, it is also shows increased toxicity. The main sources of indoor radon gas include radon separated from building materials, radon separated from the foundation soil, radon from outdoor air, radon released from water supply and natural gas. So, to control the residential exposure to radon gas, the construction site must be strictly selected. The use of building materials should be controlled to reduce the release of radon. It is necessary to reduce the use of underground hot water. When water, coal, and gas are used, effective ventilation should be maintained. Windows should be opened frequently to keep the indoor air clean. Prolonged exposure to ultraviolet radiation from the sun can lead to melanoma and other skin malignancies. Clear evidence establishes ultraviolet radiation, especially the non-ionizing medium wave UVB, as the cause of most non-melanoma skin cancers, which are the most common forms of cancer in the world. UV radiation is classified as a complete carcinogen because it is both a mutagen and a non-specific damaging agent and has properties of both a tumor initiator and a tumor promoter. It can cause tumor suppressor inactivation, oncogenes activation, and immune system depression, which result in abnormal cell proliferation and tumor genesis. Non-ionizing radio frequency radiation from mobile phones, electric power transmission, and other similar sources have been described as a possible carcinogen by International Agency for Research on Cancer. However, studies have not found a consistent link between mobile phone radiation and cancer risk. Some hormones play a role in the development of cancer by promoting cell proliferation. For example, insulin-like growth factors and their binding proteins play a key role in cancer cell proliferation, differentiation, and apoptosis, suggesting possible involvement in carcinogenesis. Hormones are important agents in sex-related cancers, such as cancer of breast, endometrium, prostate, ovary, and testic, and also of thyroid cancer and bone cancer. For example, the daughters of women who have breast cancer have significantly higher levels of estrogen and progesterone than the daughters of women without breast cancer. These higher hormone levels may explain their higher risk of breast cancer even in the absence of a breast cancer gene. Men of African ancestry have significantly higher levels of testosterone than men of European ancestry and have a correspondingly higher level of prostate cancer. Men of Asian ancestry with the lowest levels of testosterone have the lowest levels of prostate cancer. Autoimmune diseases are correlated to tumor genesis. There is an association between celiac disease and increased risk of all cancers. People with untreated celiac disease have a higher cancerous risk, but this risk decreases with time after diagnosis and strict treatment. probably due to the adoption of a gluten-free diet, which seems to have a protective role against development of malignancy in people with celiac disease. However, the delay in diagnosis and initiation of a gluten-free diet seems to increase the risk of malignancies. Rates of gastrointestinal cancers are increased in people with Crohn's disease and ulcerative colitis due to the chronic inflammation. But immunomodulators and biological agents used to treat these diseases may promote developing extra-intestinal malignancies. The vast majority of cancers are non-hereditary, also called sporadic. Hereditary cancers are primarily caused by an inherited genetic defect. Less than 0.3% of the population are carriers of a genetic mutation that has a large effect on cancer risk, and this causes less than 3 to 10% of cancer. Some of these syndromes include certain inherited mutations in the genes BRCA1 and BRCA2 with a more than 75% risk of breast cancer and ovarian cancer, and hereditary non-polyposis colorectal cancer. The abbreviation is HNPCC, which is present in about 3% of people with colorectal cancer, among others. This is the end of this section. Thank you very much.